here to take your medical questions.
The number to call is 270-9933. Let's see, we have 2 lines open if you want to give Zorba a call. Hi, good to see you.
Hi, good to be here.
We just talked about the measles a little earlier in this newscast. It's the biggest outbreak in 25 years.
Absolutely. And you know what happens is people think, well, measles, what difference does it make? But the reality is 1 out of 1,000 children will die from measles. If it's your one, it's a lot. And then there's encephalitis, so they can actually lose IQ points. And when I was a kid, there was no measles vaccine. Everyone should get their children immunized for measles. And in fact, you should make sure all your immunizations are up to date. If you don't have the new shingle shot, get your name on the list because they're behind in terms of their manufacturing. You should have, there are 2 pneumonia shots, not just 1, but 2 for adults. They're also for children with special needs and also people who have their spleens out and so on. But one of the things that's nice for people is you can go to the electronic medical record, and most of us now have an EMR from Epic, because that's our hometown person, and you can find out what immunizations you need and then get them. Get immunized. Don't be an anti-vaccinator. They don't know what they're talking about. Vaccines are great. That's why we don't have as many childhood and adult diseases. You can see where I am on this particular discussion.
You're kind of iffy on this whole thing. Let's go to the calls. We'll start with Janine in Prairie du Sac. Hi, what's your call? What's your question? Are you there? Is it Jeannie?
Yeah, hi Jeannie, can you hear us?
Yes.
Go ahead.
Hi. What can you do about neuropathy from home? Severe damaged nerve pain in your feet and legs?
Well, first of all, neuropathy, pain in your peripheral nerves, usually your foot, and pain in your ankle or in your hands. Very difficult to diagnose some of the time. Quite often it's due to diabetes. Sometimes it can be due to certain medications that you're taking. So there's some medications that actually produce a neuropathy. So number one, you really need to have a diagnosis of what it's from. And then there are medications such as gabapentin, which is a prescription drug that will help you. Some people actually like to put Bengay and things on their foot, and that will help them with a home remedy. But need a diagnosis first to find out what it's from.
Okay. All right. Let's go to Bruce in Janesville. Hi, Bruce. What's your question?
Yeah, I'm 60. First, thanks for taking my call.
Sure.
I'm 68 years old and in pretty good health. I do have high blood pressure, but it's well controlled. My total cholesterol is 198, and my LDL is 130, so I'm right on the line. At a recent physical, my doctor suggested that I might want to start taking statins to fight the buildup of plaque. He wasn't a real strong recommendation. So what do you think?
Well, first of all, there's a formula that you can use from the Framingham Heart Study. You put in your blood pressure, your cholesterol. Just look up Framingham Formula Heart Disease. Your doctor probably also has that formula. And if you're above 7.5%, then that means generally a statin. 7.5% risk of having a heart attack or a stroke in the next 10 years, then a statin really is pretty much called for. So you've got to put all those numbers into that and then figure out which way to go. Also, family history. It is the Framingham Heart Study risk score, and your doctor probably has it. Most of us do.
Interesting.
All right, let's go to Christine in Verona. Hi, what's your question?
I have a son that is 31 years old. He has a solitary rectal ulcer syndrome. He's had it for 5 years. I want to know how we can go about it. He has had colonoscopies, and I wanted to know what's the next step we can take.
Well, first of all, I'm not familiar with that particular syndrome, but I am familiar with the fact that if you're not sure what to do, getting a second opinion always makes a difference, either within that organization that you're part of or asking the insurance company to get one outside. So, for instance, from a gastroenterologist from either another medical center, another medical school, such as, Medical College of Wisconsin or Milwaukee, or another center within Madison. But that's the way I kind of approach it when I have a question. And if it's been your child's problem for that long a period of time, I think a second opinion is always useful.
Good advice.
You can't know everything, can you?
No, I can't. That's right. I can't know everything, that's for sure.
Let's go to Bonnie in Reedsburg. Hi, Bonnie. What's your question?
Yes, hi. Dr. Zorba, I read your article about the red yeast, and I'm on the cholesterol medicine, lovastatin. I've been on it for years. Now, I'm kind of confused. Is this a bad cholesterol?
No. Lovastatin is a great drug. The issue with red yeast was they were touting red yeast as a way of getting your cholesterol down without taking lovastatin. And it turned out that many of the manufacturers were putting the drug lovastatin in the red yeast. In other words, they were grinding it up in China, putting in the red yeast, and the red yeast was working. Why? Because it had lovastatin. Lovastatin was the first statin. It's a very good drug. Keep it up. Statins work. Red yeast, sometimes it's fake.
Oh, interesting.
All right. Robert, Broadhead, quickly, what's your question? It's not going to be quick. He's 62 years old, wants to know if get a measles shot.
2 measles shots, and you get them 1 year apart, and they get many different forms of measles, and it's worthwhile taking. Everyone needs a measles shot at a certain age, certainly over the age of 65.
And us baby boomers, we probably had the measles.
Yes.
I did, I know.
Yeah, you had the measles, that's right. You actually had the measles, you don't need the measles.
There you go. Thanks for everyone for calling in. Zorba, thanks for stopping by today.
Great to see you, Zorba.
Good to see you.